Your pet has eaten something toxic or has been involved in some type of trauma. Should you take your pet to the emergency room or wait and schedule an appointment with your regular veterinarian? On this episode of the Paw Report, we're joined by first-time guest, Dr. Caroline Tonozzi, to talk about emergency services at the University of Illinois Veterinary Teaching Hospital. So stay with us.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thank you for joining us for this edition of the Paw Report. I am your host, Kelly Goodwin, and as I mentioned, today we're talking about emergency services, a very serious topic, and joining us today on the Paw Report is Dr. Caroline Tonozzi, and she is from the University of Illinois. In fact, she's going to tell you a little bit more about herself and what she does at the U of I, so thank you for joining us. You're a first-time guest of the Paw Report. We love first-time guests because I get to ask you a question about your background and get to know you a little bit more. So thank you for joining us.
Sure. I'm an Illinois resident from the start, and I went to U of I for vet med, then worked in private practice outside of Chicago after my internship and residency. Then I moved back here after 10 years, taking over a position in the College of Vet Med now since 2017. Mm-hmm. I have 2 other faculty that I work with. I have a vast experience inside the hospital and outside the hospital, including been a staff veterinarian on the trail at the Iditarod.
How in the world how did you land that position?
I looked online to see how to volunteer, because they have a lot of volunteer positions, and applied. I wrote out some answers on a questionnaire, and they chose me. I've been a staff veterinarian since trail veterinarian since 2016.
So do you go to the race every year then?
I haven't gone the last couple because of COVID.
Right.
But up until that point, I was on the trail. I've been up and down, not quite to Nome, but almost to Nome, in really remote areas of Alaska where they fly me in and drop me in, and I work for 4 or 5 days, and I've been probably over half the checkpoints that have been on the trail.
How exciting. I bet you could definitely write a book or keep a journal.
There's
on,
a lot
on
of
that
things
experience.
I could talk about. Yeah, sure.
Oh, back to Illinois and the University of Illinois Veterinary Hospital. We're talking about emergency services today. Before we kind of really dive into that, it's an exciting time for the hospital right now.
Yes.
We're recording in the summertime. Lots of activity, lots of work being done, lots of renovations being done. Tell us about what's going on.
Sure. When I began back in 2017, there was this idea of redoing parts of the hospital, and being a grad, that was exciting for me, since coming back, having a new space to work in. So along with some of the technicians and the hospital staff, we came up with a idea to move and expand our emergency service and critical care so that we are a unified group. Right now we're in separate areas of the hospital. And in doing so, it's taken a couple steps to get there. We've been the last part of the renovation. And so we're really excited to have a new space, bigger space. Our service is rapidly growing, so to have that opportunity to be a part of the growth and now seeing the fruition of that will be really neat.
Absolutely. You know, we keep mentioning emergency services, and probably for our viewers, we should just explain to them, it's just like if you have to go to the emergency room for a problem, a people problem, so to speak, it's the same for pets. And that can be a really traumatic time, not only for the pet, but also for the pet owner. How do you know that your pet is having an emergency? I mean, what should a person do?
Sure. There's some criteria that we utilize to define what a true emergency is in vet med. Same in people: difficulty breathing, collapse, painful, if you just sustained trauma, had a seizure, ate something you're not supposed to, things like that all would be under the umbrella of an emergency. And so we try to identify those patients and then try to have the resources available to treat, to identify and treat those patients, in addition to more of the urgent care, which are, like lacerations, maybe they had a fight with the other dog or something, have some bite wounds, things like that, vomiting, itchy skin, things that may not necessarily be life-threatening right now, but need attention. And either it's a nighttime or weekend, or it's during the day when it's an unexpected occurrence, and their primary veterinarian's not equipped to handle those kinds of cases. So that's where we come in.
Do you recommend that somebody immediately just bring their pet in, or is there a hotline or a line that they should call to kind of explain what the situation is?
Sure.
And I guess time is of the essence too.
Sure.
When you're talking emergencies.
I think it depends on the type of emergency we're dealing with. Obviously if a pet was just run over by a car, time is of the essence because they can have major internal and external injuries. Sometimes I know for my own, I have pets myself and have to identify when it is the best to bring them to the vet. And I think sometimes we make a judgment call based on what an owner's comfort level is, and we try not to discourage people from having their pet evaluated, because a lot of times it can lead to something else that's maybe not as noticeable to them, but then when we see it, they are having some trouble breathing, or they're not comfortable and painful, and those aren't things you could deal with on your own at home. And I also try to discourage people from trying to fix wounds and things, just because we don't want that to become a bigger issue later on. So if they do call, we can talk to them and say, my pet just ate this drug, or I just saw him do this. Is that something to worry about? We sometimes can handle that on the phone. We call that phone triage. And then if they say certain things that would identify them as potential emergencies, we would have them come in. For example, like the kind of drug that they consumed, or my dog just ate a bottle of Advil, what do I do? Things like that. We would have them come in so that we can start the decontamination process, which we might not have them do at home.
You touched on something in that answer about people treating their animals at home. Do you get a lot of, well, my dog is vomiting, let me give them something that I would take for a stomach problem? That's probably not recommended.
Yeah, I think that some of the medications that people can take have ingredients in them that could be harmful to the pet, like having, like Pepto-Bismol, for example, has salicylates in it, so we wouldn't necessarily want our pets to have that. Nor does it necessarily work in the same way as it would in a dog versus a person. I actually, people are, I think, not doing that quite as much as we might think, or if they are, they're not telling us. But our goals are, obviously, if they have a question, they can certainly call us, and we, like I said, we do a lot of phone triage. We try not to treat or give treatment recommendations on the phone. We have to have a client-patient relationship in order to do that, which is why sometimes they end up coming in so that we can actually look at the patient and identify if there is something, what kind of interventions we can do, or if anything is needed.
I would say in your years of working in emergency services, you've seen a lot of clients in a lot of situations over the years. Tell us about some of those, some of the more memorable cases that you've treated.
Sure.
Or your team has treated.
I always think that one of the neatest and sometimes one of the most discouraging or heartbreaking parts of my job is that every pet comes with a family, and that family has a story of how that pet came into their life. And so we try to do our best to honor that relationship that they have, and sometimes that relationship has come about in a circuitous way, like this pet was my son's dog and my son just died of cancer, and or my mom just died, and my dog is my life. She's helped me get through whatever illness that my mom just had, and so we oftentimes are faced with making decisions about the pets in a less than ideal situation. I find that when we can reassure people and help them when they're grieving, things like that, and help them with their pets, that's one of the most rewarding parts. The other are when it's like a slam dunk, we can for sure help the pet, like they get the dog gets into the trash and they come in with a tuna can on their mouth, or they try to jump through a fence and the fencing is now caught around their leg, or things like that. Those are sometimes one of the more fun cases that we can deal with because it's so easily resolved without, and the pet's wagging their tail and super excited. Those are the ones we, I think one of my most memorable ones was this dog was having trouble chewing and they couldn't figure it out. So we looked in its mouth and had a Barbie shoe lodged on an incisor. And so
that is a memorable one.
Yeah. So we could just pick off the Barbie shoe and the dog was happy and fine afterwards.
And had a big meal, I'm sure, after that. Is the emergency room for pets very similar to what a person would experience? I guess take us on a kind of a verbal tour of what to expect when you go into the emergency room.
Sure. So I've been in the emergency room myself for wounds and things like that. So there are some similarities, there are some parallels. When a pet comes into our hospital, the owner first checks in with their pet and gives why the pet's there. Then we have one of our veterinary nurses come up to meet the owner and give a little verbal exchange about why the pet's there. And the nurse will identify if there's something that looks abnormal when they first evaluate, put their eyes on the pet. If there's if they're dangly leg, or there's blood, or if they're having some difficulty breathing, we'll identify those patients and assign a doctor and a student right away to evaluate that patient. If they don't have something life-threatening that needs immediate intervention, they'll be brought to our treatment area. They'll be given a cursory exam where we'll get vital signs, blood pressure, things like that, and then they get put in a queue, and then we work through our queue. If there's 8 patients there, ones that have the most serious or life-threatening problem go at the top of the queue, and then we work our way down. And a lot of times the others that are more urgent or stable will just be put in order of being seen as they come in. So they come at 1, 1:15, 1:30, 1:45, 2, they'll just be seen in that order. So sometimes that means there's a wait, and as that's happening, we're also, having incoming patients come in, and if a dog needs oxygen or needs immediate fluid therapy, those will get put to the top of the queue, and the others will work through them as best we can. Sometimes that means that if you came in at 2 o'clock, you may have 3 or 4 patients seen before we're able to get to your pet. So we do our best to try to communicate that with owners. I've sat in emergency rooms a long time, waiting for treatment. I also think that in human medicine, there's a lot more steps in order to get to that point. So we don't have quite as many steps with our check-in process, but for the most part, they are, the process of triage is similar.
I'm glad you answered that, because triage was a question of mine. I bring my pet in, and I've been waiting, yet somebody else comes in and they get right in. Why is that? And you explain. I mean, it's various levels of trauma and emergency.
Right. Sometimes it's hard to see from an owner's perspective.
Sure.
And we don't want to alienate anybody or feel like they're less important, because everybody comes in believing that their pet's the most important. And we again try to, as we're identifying the patients that need evaluation right now, or if we don't intervene, something catastrophic will happen. We sometimes are doing that at the same time with other patients that are doing, that have life-threatening problems. So, and we are limited to sometimes of, like everybody else, staff availability, doctor availability, things like that. So that's why our resources go to the ones that, like if we don't do anything, they could die, or they're in shock, or they're bleeding, or something like that, and then get to the less intense, more urgent injuries, like I said, like maybe a bite wound or a laceration. Maybe the dog's got diarrhea or something like that.
You mentioned when a person comes in, a pet owner comes in, they're assigned a doctor and a student veterinarian, and that leads me to my next questions. Students that are studying veterinary medicine make up a huge portion of your team. How important is that, and what do they get to do?
Sure. I think all of us on our faculty and we have interns and residents that work with us. We all have different levels of experience, and the students are working with all of us that have these differing levels of experience. And so my goals when I'm on service with them are that they get exposure to not just the house officers, but with my experience in private practice, and it's now been 18 years of practicing in vet med period, that they can work and learn alongside the interns and residents, and take the staff that's been there working with students for a long time as well. And we kind of put all of our experience together to try to lay out, there's different ways of treating things, approach, communication, the procedures we do, that there's not just one way of doing things. Second would be that they can, I want all the students that come through to have experience of doing some of the procedures that are common in emergency. I tell them each rotation comes through, if there's a procedure they want to learn about, we'll have them do it. And if there's an intern that they're working with and a student, that they work together so both get the experience. And lastly, I want them to be able to, if they're going into primary care, I say emergency medicine sometimes is just primary care on steroids, because we see the same cases, that they're not uncomfortable with those cases, that they have at least a baseline knowledge of how to triage and do basic things for the patient, which can mean life and death, when they're not in an area that has specialty care or emergency care, and it can mean the world of difference for the owners and the patient. So we have them doing their exams, their physicals, getting history from owners, talking to owners about some of the difficult things we have to talk about, especially when we're talking about prognosis. And like I said, and the owners come with their stories. There's always something to learn from that communication. And I know from feedback that I get from students, they really appreciate the communication aspect, that we let them at each part of that exam, and that they can do these procedures. Obviously, we don't want to overwhelm them, and I think sometimes emergency medicine can be overwhelming, especially when we don't have we have it, in this hour, you might see 3 patients, you might see 16 patients. So that can be very overwhelming, especially when you're young and you're not sure what to do. But that's where our staff really shines in assisting those students. I also appreciate that they've taught me a lot, because what I was doing, and I tell them all the time, I said, what I was doing 18 years ago in your shoes, this is way different than what we're doing now. And I've learned so much about vet med and from coming from their shoes and what they're comfortable with and what they appreciate and what they get excited about in as a student too. So we do our best to try to make it so that it's not such a scary place.
Well, I guess scary, overwhelming definitely is the time that we're living in now, and that is the COVID pandemic.
Yeah.
And I can probably guess that this period of time has been pretty overwhelming for emergency services. Is that true? And have you seen more cases during COVID?
Yeah. As a trend overall in the country, the emergency care has been overwhelmed in the sense that there was a time at first where, depending on where you were in the country, some businesses were closed or they were ill themselves and they couldn't provide care for their patients, so it got diverted to ERs across the country. ER has been a very vastly, rapidly growing component of vet med in general, so much so that there's a lot of gaps in being able to hire enough staff and maintain that. And the COVID pandemic kind of accelerated that, because that now you had students that were coming out of school and a lot of unknowns, and maintaining that pace for over a year has been difficult. As far as our service, yes, we've been, at first we were doing our best to try to triage for the hospital to make sure that there wasn't, we weren't overwhelming the services that we had available. Then when we started to open up in the state, the availability of some hospitals, we were here, and then they wanted we had to be here, and it was hard to sometimes try to juggle that with the needs of the other services in the hospital while also maintaining adequate care for the patients that were coming in and our referring veterinarians. Now we're, I think, at a point where we've done our best to try to manage that while also not compromising what we do in the hospital. I think having a new space will be super helpful for that, because the space we're working out of right now is a lot smaller, and the students having to do most of their communications not in person, by phone, was a huge challenge. It slowed things down because you were at the mercy of an owner and on their phone, and that sometimes an owner was available right away. Sometimes they weren't, by no fault of their own. That people have lives and things happen on, when you're doing everything by phone or by computer, it can be a challenge for everybody. So I think what we learned out of that was what's our purpose of being here? What are we able to do for our clients and our referring vets, while also trying to manage our own staff. And it's been, sometimes it's just been a balancing act to do our best for everybody.
Have you noticed more emergencies with people being home with their pets too? I mean, just the types of emergencies that you're treating?
I think with, the busiest part of the year usually is the summer, when people are not, kids aren't in school, and people are maybe at home with their pets because they have vacations, things like that. So with homeowners or pet owners at home, working from home, I think that made them potentially pick up stuff a lot faster. Also, there was a lot of people adopted pets, like 12 million pets were adopted last year. That's a huge number of pets that
they're adopted, and they also have to be treated.
Correct. And if they require care, they require care. And, some people, maybe they weren't going on vacations, or, some of their expenses then were funneled into their pets and healthcare. So I think it was a perfect storm of things. Not that it was inevitable, right? Because people were at home, but it has, even as we've opened back up, the level of patients that we've been managing has escalated too. I think it's just the nature of, what's been happening.
In our last minute of our interview today, I think it's important that people know that your emergency services 365 days a year, 24/7. What's the last thing that you can tell pet owners as we wrap up our discussion?
Sure. I always like people to be prepared for a visit, and that we give estimates for care, and sometimes that estimate can be quite high. So making sure they, for me, I had a credit card that I had for my pet that I just used for my pet. Some people like to use
Pet insurance.
Pet insurance, which also I think is a reasonable thing. Being prepared with having all medications ready to go so they can tell a doctor that they've never met, that doesn't know their pet's history, what they need. Having a good idea of the resources that the place that they're going to has available, and that we will do our best to make that connection when we're a new face to them, when they've maybe seen their other vet for 10 years, that will reassure them that we'll do our best and that we work with their vet as well.
Well, I can say I've had friends that have had to use the services at the U of I, and they give you nothing but praise.
That's
so
great.
Your staff is doing wonderful.
Good.
Well, Dr. Tonozzi, it's been a very nice and enlightening discussion today. I appreciate you making the trip to our studios of WEIU, and I hope that you have a maybe a calm summer, but as you said, that's a busy time for you. So thank you for joining us on the Paw Report.
No problem.
And thank you, our guests of the Paw Report. Until next time, I'm Kelly Goodwin. We'll see you then.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.